Why is motor threshold important for TMS bipolar treatment? Have you ever wondered how doctors personalize treatments for conditions like bipolar disorder? One key factor is something called the motor threshold. The motor threshold is the minimum amount of stimulation needed to trigger a muscle response when using transcranial magnetic stimulation, or TMS. This measurement is crucial for tailoring TMS therapy, especially for those dealing with bipolar depression. When TMS is administered, the intensity of the stimulation is often set as a percentage of the motor threshold. Typically, this ranges from 90% to 120% of the motor threshold. Why is this important? Because each person's brain is different. By using the motor threshold, clinicians can adjust the stimulation to match an individual's brain physiology. This helps ensure that the treatment is both safe and effective. For instance, a common practice is to use 120% of the motor threshold for high-frequency stimulation of a specific brain area, known as the left dorsolateral prefrontal cortex. This area plays a significant role in regulating mood. By personalizing the stimulation intensity, doctors can improve the chances of a positive treatment response while minimizing potential side effects. Another vital aspect of measuring the motor threshold is safety. While TMS is generally considered safe, using too high of an intensity can increase the risk of adverse effects, such as seizures. By referencing the motor threshold, clinicians can avoid overstimulation. On the flip side, if the motor threshold is underestimated, the stimulation might not be strong enough to be effective. It is also important to note that the motor threshold can change from day to day or even from session to session. Factors like medication changes, fatigue, or the current state of the brain can influence this threshold. Some studies suggest that measuring the motor threshold repeatedly during treatment may help optimize the stimulation dose, although this may not always be practical. In the context of bipolar disorder, where mood symptoms can fluctuate, using the motor threshold to guide TMS dosing supports a more personalized treatment approach. This is particularly relevant since many patients are also on mood stabilizers, which can affect how the brain responds to stimulation. In summary, the motor threshold is essential for TMS treatment of bipolar disorder because it allows for personalized dosing, balances efficacy and safety, accounts for individual differences, and supports standardized treatment protocols. By tailoring the treatment to each person's unique brain physiology, healthcare providers can maximize the benefits of TMS while minimizing risks. Always remember to consult with healthcare professionals for personalized medical advice.